Hello, my name is Madeleine Williams and this is my group presentation for domestic violence against women, looking at male as perpetrators of domestic violence from a forensic psychology point of view. I've defined domestic violence, taken that from the American Psychiatric Association. The definition there is a pattern of abusive behaviours, and that includes a wide range of physical, sexual, psychological maltreatment used by one person in an intimate relationship against another to gain power unfairly or maintain that person's misuse of power. So it's largely accepted that there are many forms of family violence. For the purpose of this presentation, I'm going to look at it as males being the offenders and females being the victims, but also acknowledging that there's same-sex relationships and children offending as well that can occur in family violence. So my presentation will have a look at the etiology, so individual factors that perpetuate offending, why it's important that the courts address this, so the impact of family violence on women, looking at evidence-based practice, so men's behaviour change programs, and some personality profiling and typology assessments that are starting to be used in the field. And there's also some information around specific services, which services work with offenders and what they do. So starting off looking at the etiology, so individual external factors, I examined a systematic review which looked at 25 longitudinal studies that examined perpetrators and victims of domestic violence. Costa et al. Found that for perpetrators of violence, there was 4 different areas that were longitudinal predictors, and that was the family of origin, so being a single parent, witnessing parental violence, poor relationships with parents in childhood, boundary violations, so for example if the children are being parents to the parents, and parental drug use and criminality increase the likelihood of offending later in life. Child and adolescent abuse, so this is one that's often debated about, but this looked at 5 journal articles that investigated if people were abused as adolescents, if they were more likely to offend in adult intimate relationships, and the answer was that there was a positive correlation there. They also looked at the behavioural factors, and this had inconsistent findings in the literature. So my assessment of why this is because it wasn't completely an external factor, and that there would be, if it's an internal factor, there would be other things at play, such as neurological personality factors interacting with the variables. And socio-demographic, so if the offender was from a low socioeconomic status, or socioeconomic status was a predictor that he would then offend later in life. So I did an analysis of this research, and the strengths were that the systematic review had a strong level of research included, so 25 peer-reviewed articles, and it highlighted the discrepancies in the research, in the discussion, for example, the role of behaviour as a variable, and I guess the weaknesses as well that I found was in the discussion section. I identified that while the research articles separated gender for findings, there was a lot more women that were reporting being perpetrators and victims of domestic violence, which is inconsistent with statistics that women are offended against in the population more, and this might indicate that there was gender disparity in the participation sample. And with adult perpetration and victimisation, it was highly correlated, so there was no ability to test for why this occurred, and this creates confusion as to if the longitudinal factors were predictors of perpetrating violence or being a victim of violence, if there was a strong link between those. So the next part of the presentation looks at the impact of male family violence on women, and I've just pulled a resource there which is from DHS, which run child protection, so a really forensic based assessment on group minimum standards for men's behaviour change. So the next slide goes on to explain what happens to women when they're offended against, and the ABS stats there articulate 20% of women have experienced family violence by their male partner. So based on the last slide, the 3 areas that they've identified as being impacted are mental health, anxiety, depression, PTSD, insomnia and phobias, cognitive, poor concentration, intrusive thoughts and poor memory, and reproductive health is a really important one. Offending often begins when women are pregnant, and stress can have an impact on the pregnancy, Stress can also have an impact on a female's ovulation cycle, and then of course the more obvious one, that if a woman is pregnant and is assaulted physically, that can have harm to the fetus. So how do we sort of begin to treat this really huge problem that has a huge impact on the community and women? Males that perpetrate domestic violence and are in a forensic setting are often mandated to undergo treatment and assessment. Reports about engagement and attendance with forensic psychologists are given back to the court to assist in determining risk. Treatments can include one-on-one counselling or group therapy, and this is administered by forensic psychs, general psychs or social workers. The type of group therapy for male perpetrators that's considered best practice is the Men's Behaviour Change Program, and the reasons that this is more effective is below in that diagram. So it's peer-driven, meaning that the content is provided from other offenders and the psychologist facilitates the intervention rather than drives the content. And there's also a high level of accountability, so denial and minimisation and those sorts of things are taught by the facilitator. And then the offending males hold each other to account. So what sorts of organisations offer men's behaviour change? Men's Line, Family Life, LifeWorks and Anglicare. And if you go onto the Men's Life Australia website, there's a 2-minute video and there's a guy that's on there talking about his experience about what's done in the program, and the therapist asked him, can you remember the last time that you had an outburst? And he said, my right leg was twitching and my fists were clenched and my heart rate goes up and then I just black out. She asked him how he felt at the time, and he was able to recall that he was flustered, he wanted to die, he didn't feel heard, wanted to yell, and he felt really justified and frustrated. So if all of the programs are a safe space like that, hopefully they can begin to identify some of these things. Later in my presentation, it has a look at different individual factors, and 2 of them that are really important are that they have low levels of assertiveness and also low levels of self-esteem. So that might be related to this man's anecdotal experience of being in men's behaviour change. So Mayer is a new piece of research, 2018, that looked at the role of fatherhood as a motivator to reducing family violence. He argued that punitive responses from courts and systems had little impact on reducing recidivism, and that the male's offender's relationship with their children was more meaningful to reduce that. So the men had little empathy towards their female partners, but they did really care about their relationship with their children. So this is potentially something that we can look at as a way of motivating men to engage in therapy. They're also starting to introduce profiling, so looking at impulsivity, social skills and attitudes towards women to create typology profile. And the spectrum can range in results from mild risk to generally violent and antisocial. There is ample research that demonstrates males that perpetrate violence have low self-esteem and low assertiveness, and the field of forensic psychology can use this information and these typology assessments to help the courts make informed decisions about bail sentencing, risk level and assessment. So this slide just outlines that basically with these new pieces of research, there's a really small sample size and there's no other research that supports the findings, so there's low reliability at this stage. In summary, domestic violence is a really serious issue. It affects 1 in 5 women. There's individual external factors that perpetuate violence, so longitudinal predictors, as outlined at the beginning of the slide. And men that offend against women are charged and then placed in a court system for punishment and management. Often men are mandated to treatment programs such as men's behaviour change programs where behaviour patterns are challenged in a group setting by other offenders. Forensic psychologists can assist the courts in things like IVOs, family law court matters, child protection matters, in assessing the risk and also advising on appropriate treatment models. There are new ideas about how to treat offenders, but these are yet to be empirically tested with a large sample size. Thank you very much, and I'll pass you on to my colleague now.